Two of the world's leading authorities on bariatric and metabolic surgery have issued new evidence-based clinical guidelines that, among a slew of recommendations, expand patient eligibility for weight loss surgery and endorse metabolic surgery for patients with type 2 diabetes beginning at a body mass. The American Society for Metabolic and Bariatric Surgery, ASMBS, is the largest group of bariatric surgeons and integrated health professionals in the United States and the International Federation for the Surgery of Obesity and Metabolic Disorders, IFSO, represents 72 national associations and SOCI. It's time for a change in thinking and in practice for the sake of patients. It is long overdue. In the 1991 consensus statement, bariatric surgery was confined to patients with a BMI of at least 40 or a BMI of 35 or more and at least one obesity-related condition such as hypertension or heart disease. There were no references to metabolic surgery for diabetes or references to the emerging laparoscopic techniques and procedures that would become mainstay and make weight loss surgery as safe or safer than common operations including gallbladder surgery, appendectomy, and knee replacement. The statement also recommended against surgery in children and adolescents even with BMIs over 40 because it had not been sufficiently studied. New patient selection standards. Times have changed. The ASMBS, IFSO guidelines now recommend metabolic and bariatric surgery for individuals with a BMI of 35 or more, regardless of presence, absence, or severity of obesity-related conditions, and that it be considered for people with a BMI 30 to 34. 9a. It was also recommended that obesity definitions using standard BMI thresholds be adjusted by population and that Asian individuals consider weight loss surgery beginning at BMI 27. 5. Higher levels of safety and effectiveness for modern-day weight loss surgery. The new guidelines further state, metabolic and bariatric surgery is currently the most effective evidence-based treatment for obesity across all BMI classes, and that, studies with long-term follow-up, published in the DEC. Roughly 1 to 2% of the world's eligible patient population get weight loss surgery in any given year. Experts say the overly restrictive consensus statement from 1991 has contributed to the limited use of such a proven safe and effective treatment. Globally, more than 650 million adults had obesity in 2016, which is about 13% of the world's adult population. CDC reports over 42% of Americans have obesity, the highest rate ever in the U.S. The ASMBS, IFSO guidelines provide an important reset when it comes to the treatment of obesity, said Scott Shakora, MD, President, IFSO. This recommendation is also included in the ATIS, Standards of Medical Care in Diabetes, 2022. Make a difference. Sponsored opportunity. Story source. Materials provided by American Society for Metabolic and Bariatric Surgery. Note: content may be edited for style and length. Journal reference: Dan Eisenberg, Scott A. Shakora, Edo Arts, Ali Aminian, Luigi Angrasani, Ricardo V. Cohen, Maurizio De Luca, Silvia L. Faria, KCPS. 2022 American Society for Metabolic and Bariatric Surgery, ASMBS, and International Federation for the Surgery of Obesity and Metabolic Disorders, IFSO, indications for metabolic and bariatric surgery. Surgery for Obesity and Related Diseases, 2022. doi 10.1016, J. SOARD. 2022. 08.013. Cite this page. American Society for Metabolic and Bariatric Surgery. After 30 years, new guidelines for weight loss surgery. Medical groups replace outdated consensus statement that overly restricts access to modern-day weight loss surgery. Science Daily. After 30 years. New guidelines for weight loss surgery. Medical groups replace outdated consensus statement that overly restricts access to modern-day weight loss surgery. After 30 years. New guidelines for weight loss surgery. Medical groups replace outdated consensus statement that overly restricts access to modern-day weight loss surgery. Science Daily. https://ift. ut.me. Accessed October 21, 2022. Thanks for watching. Please subscribe my channel for more videos.